Thanks for joining us for this webinar. My name is Jen Dunkin, and I'm a local pharmacist in the Sea to Sky corridor. The purpose of this webinar is to help you manage your pain and medications after injury, and it'll take about 45 minutes to review the content. The objectives for this session are generally to be able to provide you with the knowledge and tools to help you best understand and manage your pain, with a focus on pain medication, how it works, and to provide you with some tools to best manage your pain. There aren't many places in the world where most of the town's population is on a first-name basis with an orthopedic surgeon, or a common discussion topic is about the best physiotherapist in town. We like to play hard in the Sea to Sky corridor, and unfortunately, this results in some unintended consequences. There are nearly 5,000 documented recreation-related injuries per year, and those are just the ones seen at the Whistler Healthcare Center. You're likely listening today because you've sustained one. Now, everyone's situation is a bit different, so while I'll be presenting some general information about pain and medications, you may require additional information about your specific circumstances. I'll also discuss resources you can access to help provide this information. Let's talk a little bit about the characteristics of acute pain first. So acute pain is the pain that has a sudden onset, and it's generally a result of some sort of trauma or injury. It's generally sharp in nature, so people wouldn't typically describe it as dull or tingling. And while it can be quite distressing in the hours and days following the injury, you'll find that over the course of several days to weeks, the pain will lessen and you'll be able to gradually return to your everyday activities. Acute pain generally resolves in under 3 months, and much of the time, much sooner than that. When you're speaking to healthcare providers or perhaps doing research following your injury, you may come across some of these terms related to pain. Hopefully, an improved knowledge of this will help you to communicate more effectively with others regarding your pain. So baseline pain, which is also known as background pain, is a lower level of pain that's always present. This is normal and can actually be helpful in letting you know how much you can do or push yourself physically. It's not realistic to expect that you will not have any level of pain or that there will be a treatment to eliminate pain entirely. This baseline pain should still allow you to function, to concentrate, to sleep, to read, although your overall ability to do daily tasks may be reduced. Breakthrough pain is a spike in pain that is above your normal level of background pain. If it's related to a specific activity, for example, increased movement at a physio appointment, it is called incident pain. Sometimes, however, you may not be able to directly associate the increased pain with a cause. This is to be expected, but should become less common or severe as you recover from your injury. If it's recommended to take your medications around the clock, this means that you'll take medication on a regular basis, regardless if it is daytime or nighttime. For example, if you're told to take a medication every 4 hours, then you may want to set an alarm to keep on track with the schedule. One reason for this would be a situation where pain is expected to be more intense, perhaps the first 48 hours after surgery, or if there is a sudden surge in pain and you need to make sure you keep on top of pain management until it subsides. Our last term is referred pain, and this means that pain from a particular area of injury is felt elsewhere in the body. In some cases of neck injury, for example, pain may be felt in the shoulder. This can sometimes make it challenging to diagnose the root cause of the injury. It could also be a sign that there is more extensive muscle damage or nerve damage. Sometimes, however, referred pain is just a result of an injury to a joint that causes muscle spasm and pain elsewhere in the body. We'll take a look at a few pain scales, and chances are at some point in your life you've been asked to rate your pain on a scale of 1 to 10, where 1 is no pain and 10 is the worst pain you can imagine. Pain scales can be helpful to assess your level of pain at a specific moment in time. For example, you may be asked to rate your pain before or after a certain activity like physiotherapy. It can give you an idea of how effective your pain management strategies are, or if you're pushing yourself too much returning to activity. Some questions you might be asked are, what number from 1 to 10 would you rate your pain at right now? What about when your pain is at its worst? When you take your pain medication, how much does it reduce your pain by? Does it go from an 8 to a 4? This information is useful to evaluate your healing process and also to understand more about what helps and what might worsen your pain. Another way to assess pain is to consider how it affects your daily functioning. The typical course of an acute injury is that your function may be significantly limited immediately following the injury or surgery, but that your level of function should gradually improve over days to weeks. This might be a more helpful way to assess your progress in healing compared to an in-the-moment pain scale. So for example, in the first week following your injury, you might spend the majority of your time in bed or on the couch in your home, somewhere between a 0 and 10% functional scale. By the second week, however, you notice that you've gone out to meet a friend, picked up some groceries, or made it to two appointments. And this might put you somewhere between 20 to 30% on the functionality scale. Revisiting this scale on a regular basis can help keep you motivated even while the healing process seems painfully slow. The next set of questions are ones that you may want to consider as you assess your pain. They might also be asked of you at healthcare appointments with a doctor, your surgeon, your physiotherapist. Don't always wait for the healthcare team members to perform an assessment. Thinking about some of these questions can help you to identify any potential yellow or red flags that could cue you to follow up with somebody sooner rather than later. As we go through some of these questions, you may want to quickly write down how you would answer them if they were being asked of you today. To start the assessment, the first obvious question is, what parts of your body hurt? Are you able to directly identify the area of pain, or is it more of a general nature? Onset. This might be fairly straightforward, as in the case of an accident or injury, but it could also be pain that's gradually increased over time. For example, you may have had a minor tweak to your knee after a fall on the mountain, but the pain has been worsening over the last 2 weeks. Provoking. Think about the things that make your pain better or worse. You may have to modify your daily activities temporarily if anything significantly worsens the pain. Likewise, things like elevation of the affected limb or icing a swollen joint may help to improve the pain. Quality. Some descriptions for pain are aching, burning, crushing, numb, stabbing, tingling, shooting, throbbing, all sorts of lovely terms. Radiation or referral, as we discussed earlier, could be a sign that there is injury that needs to be further investigated. There might be nerve involvement, or it could be attributed to muscle tightness around the area of injury. But it is important to know if the pain spreads elsewhere throughout the body. Severity. This is where pain scale might come in handy to help identify what the intensity of pain is. Treatment. Think about how much and how often you're taking medications to manage pain. As well, it's important to keep track of how well they work and also if you experience side effects. This can also be applied to other forms of treatment: ice, elevation, massage therapy, physiotherapy, that are all a big piece of managing pain. But we'll talk more about medications in the upcoming slides. A couple more to go through. Understanding. Consider the pain and function scale here as well. And values. This is going to be different for everybody based on your goals, but be sure that when you're considering that, you're aware that no pain is not likely to be a realistic goal, at least not initially. It's important to be aware of your feelings, as some people may have a lower depressed mood as a result of their pain or injury. And we want to be aware that this is a part of managing your pain effectively. Others may find that they're more irritable or angry, and this could potentially affect relationships, or at least prompt you to come up with a plan to manage these sorts of relationships more effectively. There are a few other tools that you might come across as you heal from your injury, especially if your pain becomes more challenging to manage. We'll review them briefly so you're aware that they can be useful. This is an example of the brief pain inventory tool that might be used by a healthcare provider, such as your doctor, to help assess your overall pain management. And essentially, it reviews a lot of the questions that we just discussed. The second section of this form looks at other areas of your life that may be affected by your pain or injury. This can be a good way to identify areas of concern. It works best when you have a series of assessments done over time so you can compare them and either see progress or perhaps regression in the scales from the brief pain inventory. If you're having trouble getting on top of managing your pain, using a pain diary may help you to think more in depth of your daily activities. This is one example of a pain diary, but there's a lot of different examples online that you can access free of charge. It can be helpful to think more in depth about your daily activities, identify some triggers, and understand what is working to help manage your pain. This would be something that you would complete on your own over a period of several days. So now that you have a better understanding about pain, let's talk a little bit about goal setting for pain management. And as we've mentioned earlier, it isn't realistic to expect that you'll have no pain, at least not initially. Instead, we want to focus more on overall function as you recover from your injury. For example, in the first week after your surgery, you may not want to think about getting out and socializing, but instead set a goal to rest comfortably at home and follow your healing plan with regards to nutrition, sleep, ice, or heat. Function can be related to activities at home or work and might also include relationships with other people. An example of a functional goal for the first week after your injury or surgery might be to ice your knee 15 minutes every hour or to complete the recommended rehab exercises 4 times a day. Quality sleep is very important as your body produces important immune system cells while you're sleeping. Keeping your sleep cycle on track with consistent sleep and wake times will help you to get a good sleep at night. Pain medications may make you drowsier than usual, especially in the first few days when you're taking the medications more frequently. This might mean that you spend more time sleeping during the day, and the trade-off could be that you don't sleep well at night. There are a number of resources on the Pain BC website that can be helpful for you if you're having trouble sleeping. One other goal of pain management is to minimize side effects from medications. Typically, increasing the dose of medications does not increase the pain fighting potential, but will likely increase side effects. In general, side effects can be expected with most pain management meds, but they are generally mild and your body should get used to them within a day or two. We'll discuss this in more detail and provide you with some management tips in the upcoming slides. But essentially, our goal is to find a balance between benefit of medications and minimizing or managing side effects from those same medications. So we'll talk a little bit more about some of the common medications used for managing acute pain. And note that we don't use the term painkillers. This implies that a pill will eliminate the pain entirely. And as we've already discussed, we know that this is not the case. So the goal that we have for medications, which is similar to other treatments for pain, is to help to reduce the pain so that you can improve your overall functioning and heal more effectively. Some people might be resistant to using medications at all for managing their pain because they feel that it could provide an unrealistic ability to identify their pain, and it could lead them to overusing their injured area and damaging it more. Again, we know that we just want to keep the pain at a level where you can function appropriately. but we don't want to overtreat so that you're either unable to function or burdened by side effects. We'll talk first about acetaminophen, which you may also know as Tylenol, Panadol, or paracetamol. And it's one of the most commonly used medications that we have to manage milder types of pain. Most products containing acetaminophen are purchased over the counter without a prescription, but it can also be found in some prescription medications like Tylenol 3 or Percocet that contain stronger opioids in combination with acetaminophen. It does have other uses and can be used to treat fever, so it's found in a lot of cough and cold medicines. Anytime you see a product on the shelf that advertises it is effective for fever or sore throat, it probably has acetaminophen in it. And in fact, it's found in over 600 products that you find both over the counter without a prescription and prescription products. So it's really important to check ingredients. The reason for this is that acetaminophen overdose or excessive dosing is the most common cause of liver injury seen in Canada. And one of the main reasons is that it is found in so many products that it can be easy to take more than the recommended daily dose. Liver injury can also be of concern if you're taking acetaminophen regularly and drinking alcohol. For most people, we recommend a maximum daily dose of 4,000 milligrams or 4 grams per day. And this would be 8 extra strength Tylenol pills, which usually have 500 milligrams of acetaminophen, or 12 regular strength pills, which have 325 milligrams. So an example of this is if you have a prescription for Tylenol 3, you're going to get 325 milligrams of acetaminophen per tablet, and your maximum daily dose would be 12 tablets, which could seem like a lot, but consider if you also purchase some extra strength Tylenol, which has another 500 milligrams of acetaminophen per tablet, it doesn't take a lot to meet that daily maximum. If you do have some pre-existing level of liver impairment, acetaminophen may be a medication that you want to avoid. And it is always important to check with your pharmacist, especially if you're taking a combination of medications to treat pain, that you aren't getting too much of a single ingredient. The next group of drugs we'll talk about are the NSAIDs, or non-steroidal anti-inflammatory drugs, or anti-inflammatories as most people call them. They're also commonly used to treat mild to moderate pain plus inflammation, and can be purchased without a prescription over the counter in products containing ibuprofen, Advil, Motrin, Nurofen, also products containing naproxen at a lower dose, such as Aleve. Other products like diclofenac, which is Voltaren, ketorolac, which is Toradol, are prescription only. And aspirin is another common anti-inflammatory, not used quite as commonly for pain, but still important to know, as people do often take aspirin on a daily basis for other conditions. It's really important to check with your surgeon or family physician before taking anti-inflammatories, as they may not be recommended in certain situations. For example, if you've had a fracture or certain surgeries, as there is a concern about bone healing in people taking anti-inflammatories following fractures. It is generally recommended that you take anti-inflammatories with food, as they are known to cause stomach irritation, especially if taken on a regular basis. And anti-inflammatories, or NSAIDs, can interact with some other medications or medical conditions like high blood pressure. So again, please be sure to check with your pharmacist to make sure they are safe for you to take. Opioids are commonly used to treat moderate to severe pain for a short period of time. They're stronger than the medications that we just reviewed. There really is poor evidence to show that they have benefit with longer term use, for example, in many chronic pain conditions. Opioids are classified as controlled substances. Therefore, doctors are required to carefully monitor their use and may be limited with the frequency that they can prescribe them. You might come across the term narcotics when people are talking about opioids. And opioids are technically narcotics, but that term also includes illegal substances like heroin or cocaine. So examples of opioids by prescription would be codeine, which can be found on its own or in combination with medicines like Tylenol 3, or tramadol, and these are generally considered to be the weaker opioids. Morphine, oxycodone, and hydromorphone are considered to be stronger opioids. Fentanyl as well is a stronger opioid, but wouldn't normally be used in an acute pain situation. If you've had surgery, you might get a prescription for both hydromorphone and Tylenol 3, especially if you've had surgery through the Sea to Sky Orthopedics. Generally, it's suggested that you use the stronger product, or in this case, the hydromorphone, for the first few days while the pain is anticipated to be worse. After 48 to 72 hours, most people can step down to the Tylenol 3 and use that for pain management. It wouldn't be recommended to use both at the same time. As well, if you find that the hydromorphone is not working to help manage the pain after surgery, it would be advisable to see a doctor to ensure that there aren't any complications or problems with the medication use. This would be preferable over combining the Tylenol 3 with the hydromorphone, which could put you at risk for increased side effects. So side effects are typically the most prominent in the first couple of days when you take the medication. For example, you might find that you're quite drowsy at first, but that this improves over time. Some side effects like constipation can continue as long as the medications are taken and require close monitoring and management. And one unusual side effect associated with opioids is called hyperalgesia. And this is when doses are increased quickly and can actually result in an increased pain sensation. Constipation is probably the most bothersome side effect of opioid medications and the one that people don't really want to talk about. So I'll talk about it. These medications slow down your gastrointestinal system, and this combined with reduced movement, probably a less than ideal diet, and maybe reduced fluid intake can cause constipation. It can become really uncomfortable if it's left untreated and can result in the need to use enemas or suppositories to treat, which really isn't fun for anyone. In general, it's recommended that you have a bowel movement at least every 3 days, or perhaps more often if that's normal for you. Medications like Senecot or Peglax are typically recommended to take regularly while you're taking opioids to help prevent constipation. Your pharmacist can help you to determine what the best regimen will be for you. Overdose is very unlikely if the medications are taken as prescribed and not combined inappropriately. Also, it's not recommended that you use opioids in combination with other drugs that your healthcare team is not aware of, including alcohol, sleeping pills, or other street drugs. People are often concerned about opioids and addiction, especially as we hear a lot about this in the news, and this could have an unintended consequence of making people not want to take any medications to manage their pain. I'll talk a little bit about dependence versus addiction and what the two terms refer to. So if you're taking regular opioids over a period of greater than 2 weeks, you'll likely develop some level of physical dependence, which means that you could experience symptoms of withdrawal if the medication is stopped abruptly. We generally try to limit use of opioids to less than 2 weeks. And if people are taking them longer, when it's time to come off, we'll withdraw them gradually in a controlled manner to minimize any of these withdrawal symptoms. Addiction, on the other hand, has an additional psychological component. It usually develops over time. People may have predisposing risk factors, and we often see rapidly escalating doses of pills being used, or the medications are being used for reasons other than pain. The majority of people using opioids appropriately for acute pain conditions do not become addicted, and we do want to ensure that pain is appropriately managed following an injury. Short-term opioid use can be a helpful tool for this. And it's also important to emphasize that opioids are not going to kill your pain to the point where you won't be able to feel that pain response that lets you know that you should back off or reduce your level of activity. It's actually less helpful for the healing process to allow your body to experience strongly the acute pain than to help manage it safely with opioids and other medications. There are a couple other classes of medications that will be used less frequently in acute pain management, but may be considered, especially if there is a component of nerve pain or if traditional approaches to managing pain aren't working adequately. There are some medications that are classified as antidepressants that can be effective for pain with a neuropathic or nerve component, and they can be used regardless of if somebody has depression symptoms. As I mentioned, they're mostly seen in chronic pain management, but some examples could be amitriptyline, nortriptyline, or duloxetine, which is also known as Cymbalta. One of the side effects of these medications that we also use to our benefit is that they can be helpful to help with sleep disturbances, but they can take up to 6 weeks to see a full benefit of their actions. Some side effects with these medicines include dry mouth, drowsiness, or constipation. Another class of medications that are used for more often in chronic pain, but sometimes in acute pain that's more complicated, are anticonvulsants. And again, these are used for their pain potential, regardless of if somebody has a history of seizures. Some examples that you may have heard of are gabapentin, pregabalin, or carbamazepine. And generally, these medications are started at very low doses and gradually increased until we see effect. And side effects such as dizziness and drowsiness are often reduced with time. Some other treatments that might be used are topical agents, or agents that are applied directly to the skin. And usually this can be anti-inflammatories or other anesthetics in a cream or a gel form. There are some non-prescription products that can be used topically, but often you would also see prescribed products by a doctor compounded in a pharmacy that have a combination of pain managing ingredients. They're usually well tolerated because they're not being ingested and therefore don't have effects on the stomach, nausea, constipation, and can be helpful in combination with other treatments. Muscle relaxants can sometimes be used, especially if somebody has a lot of muscle spasm or tightening. Generally, these are used in the very short term, usually not longer than a week. One of the downsides of muscle relaxants is that they're very sedating. Most people find they can't function adequately during the day while they're taking them. Medical cannabis is becoming a popular alternative for patients, although there's not much evidence for its role in treating acute pain. If you do decide to try medical cannabis, be sure to let your healthcare team know what you are taking. You might need to try products with different concentrations of THC or CBD, and as always, it's recommended that you use the smallest dose required to help control symptoms. The evidence that we do see for medical cannabis is often in chronic pain situations and sometimes in inflammation. There are also some natural health products that may be considered for people treating pain. Curcumin is found in turmeric and can be helpful as an anti-inflammatory and with circulation. So you do need to take it cautiously if you're taking other anti-inflammatories or blood thinners. Glucosamine plus or minus chondroitin is most often used when patients have osteoarthritis. It does take several months to see benefit and is generally recommended to take long term. And it may or may not be helpful for everyone. A trial period of about 3 months is usually recommended. Capsaicin, which comes from the hot pepper, may be helpful to reduce pain and inflammation in types of arthritis or nerve pain conditions. This medication also needs to be used regularly, and it's usually used topically on the skin 4 times a day for up to 6 weeks to see a benefit. And fish oils, which contain omega-3 fatty acids, may be helpful with inflammation. And several of these compounds are also included in anti-inflammatory diets, which you can get more information about from local dietitians or nutritionists. There are some common myths about pain management that I'd like to touch on, and hopefully the material we've covered so far will help you to answer them. Are my medications not working if I still have pain? As we've discussed, the medications we have to help manage and reduce pain rarely resolve it completely. If your pain is not responding at all or worsening, this could be a sign that follow-up is required. Why should I talk to my pharmacist about medications if they can't change my prescription? Your pharmacist can often suggest ways to help manage side effects or give you tips on optimizing your medication use. They can also communicate with your physician if required and make suggestions if there are issues with the current prescription. Lastly, pharmacists are accessible healthcare providers. You can usually speak with one on the phone in a matter of minutes, who can quickly help to answer questions or concerns you might have about your injury or medications. Another area that pharmacists can be helpful with is suggesting less expensive alternatives if you have trouble paying for your prescriptions. I seem to need more pain medication recently. Does this mean the pills aren't working? Sometimes your body can develop tolerance to the medication, but this is more likely a sign that an injury is not healing properly, or perhaps an infection is developing. We'll talk more about red flags in a moment. Does everyone who takes an opioid become addicted? As we've mentioned, addiction amongst people who take opioids to manage acute pain conditions is very rare. Fighting through the pain without meds will make me stronger. Especially in the first few days after an injury or surgery, if your pain isn't effectively managed, it can actually impair healing. It can sensitize the nervous system, increase anxiety and stress, and also increase cortisol levels, which may affect healing. As well, it could affect your ability to participate in recommended rehab or activity. This isn't a time to be a superhero and fight the pain. Going along with this, people might be concerned that taking pain medications might make them more prone to not feeling the pain and injuring themselves. And again, we know that taking the pain medications will actually allow you to move better, be more functional, and recover from your injury more effectively. But pain medication won't fix the underlying problem. It will help improve your function, though, and allow you to participate in your rehabilitation plan. In the majority of cases of acute pain, there won't be complications, but it is important to be aware of warning signs, some of which we've already discussed, that could signal either a complication such as an infection or factors that might increase the risk of acute pain turning into chronic pain. So yellow flags, which can include withdrawing from friends and family, frequent low or negative moods, being involved in a complicated insurance claim, or overall having a lack of support while you recover are things that you'd want to identify, take note of, and seek support within a few days before they turn into larger issues. Being involved in your pain management can help to improve your access to these types of issues, or your access and awareness to these types of issues. Red flags such as fever, swelling, a pain that's much more intense than you think it should be, or pain that continues beyond a time where it should have healed, definitely beyond 3 months, but in most cases, even beyond several weeks, need to be dealt with immediately. This could mean a trip to the emergency room if you're not able to get in to see your family doctor in a reasonable time frame, or an urgent visit with your surgeon in a worst case scenario. I wanted to discuss a few tips about using medications to allow you to get the most benefit out of them. Often we'll use medications from different classes together to help manage your pain more effectively. As I've mentioned before, doubling the dose of a medication doesn't necessarily double the effect, but may double the side effects. And this is why using a combination can help keep the doses of the individual medications a little bit lower. We always want to encourage you to use the lowest effective dose that manages your pain, and this will help to also manage side effects as well and minimize them. Immediately after surgery or after your injury, it's easiest to prevent the pain than to cure it, and we call this staying on top of treating your pain. After surgery or after your injury, the pain may be the most intense, and this is when it could be recommended to take your medicines around the clock or regularly every 4 hours for a couple of days. Treating the pain before it breaks through and becomes unmanageable can be much more effective than waiting until it is intolerable and then trying to catch up. If you no longer need to take your pain medications around the clock, you may want to consider taking a dose of medication for breakthrough pain earlier on when the pain is presenting itself, rather than waiting until the pain becomes an 8 or 9 out of 10. For example, if you're planning an outing and know that it will be physically demanding, perhaps you can take some pain medication about a half hour before so that you can keep it from escalating. Know your team and how they can help. Pain and injury can be very isolating, especially in the Sea to Sky corridor when everybody is out being active and doing fun things. So it's important to know who you have on your healthcare team and how you can reach them. Beyond your immediate healthcare team, you might want to consider calling on family, friends, or even neighbors that you know to help get you out. Community services societies in Whistler and in Squamish can also be important resources, especially if you're struggling with work or insurance-related issues. Lastly, we've been focusing about medications for pain, but as we know, pain is very complex and is most optimally managed when medications are used as part of a comprehensive plan. This could include different rehab modalities, a nutrition plan, or counseling. I do also have some strategies that may help you to manage your medications better so that you get the most from them. It's really important to plan ahead. At each appointment, your doctor will give you a prescription for the amount of pills that you should need to get you through until your next appointment. But this may not always be the case. Know that if you run out of your medications ahead of the time you have planned, it can be very difficult to get a new prescription refilled. If your appointment date is changed, make sure that you also come up with a plan to manage your medications for that time. You want to make sure you keep your medications safe, because if it's lost, it may be difficult to get a replacement prescription. If all else fails, your pharmacist may be able to provide you with a few doses of medication in an emergency situation, but this wouldn't apply for opioid medications. We've talked a little bit about side effect management already, and we know that many side effects will be short-lived. In some cases, however, like constipation from opioids, you should have a plan for prevention while taking the medications. If you're ever having a problem tolerating your medications, call your pharmacist or doctor. There are often simple tips, taking the pills with food to prevent nausea, for example, reducing the dose or changing the schedule that might work better for you that can be suggested. Please don't feel as though you have to suffer through with the side effects. It's also ideal to come prepared to your appointments because you may not have a lot of time to spend with your doctor. Being prepared will help make sure your priorities are dealt with. I'd suggest that you write down all of your questions or concerns ahead of time and make sure you bring the list to your appointment. Be prepared to discuss how you're feeling both physically and emotionally. If you've been completing a pain diary, you might want to bring that. Think about any worries that you have. Do you have any issues related to treatments or side effects? Are there any concerns with your insurance or healthcare benefits? Can you afford your medications? And are you clear about your treatment plan? Is there anything that's still confusing to you? Now's your time to ask. This slide reviews 5 questions you should always ask or be able to answer about your medications. If your healthcare provider doesn't review any of these with you at your encounter, either while you're with the doctor or while you're at the pharmacy getting your prescription, please ask and get them to repeat it until it is clear. If you have a friend or family member picking up your prescriptions for you, you may want to follow up with the pharmacist in person, as the details of your medications may not be properly understood or shared by your friend or family member. The first one is changes. You should know if any of your medications have been changed and why have these changes been made. Continue. What do I keep taking? What should be stopped and why? Proper use. This would be, how do I take medications? With food, on an empty stomach? How long do I need to be taking them for? Monitor. How will I know if my medication is working? What should I expect? And what side effects to watch for? And follow up. When do I need to book my next visit? And what do I need to do in the interim? Lastly, because medications can be dangerous if not used correctly, it's important to make sure that they are safely stored and disposed of. They should be kept out of sight and out of reach from others, especially from children and pets, as often one dose could be dangerous. Don't share your medications, even if you're trying to be helpful. We often keep our medications and put them away after they are no longer needed, just to keep on hand in case somebody needs them. But again, we know that medications aren't for everybody, and we really wouldn't want to inadvertently harm somebody. Disposing of unused medications safely helps to avoid accidental poisoning. Please don't throw your medications in the garbage or down the sink. Return them to a pharmacy for safe disposal. If you're looking for more helpful resources regarding pain management, please take a look at the Pain BC website. It's got a lot of great resources for you. Thanks for joining me and reviewing these tips and tricks to help manage your acute pain more effectively. I hope you have a successful healing journey. Take care.